Welcome to the patient assessment scenario. In this training, you'll encounter a patient experiencing an unknown medical issue. Your task is to use your skills in assessment and critical thinking to determine the best course of action. As a first responder, every call presents a unique set of challenges. So take your time, gather information, and remember, your ability to assess accurately could make all the difference. If the timer's too fast initially, don't be afraid to pause the video to give yourself more time for thinking for the best improvements. Pausing and writing down your answers will always be the best way to learn. Fire dispatch to Medic 70, you are dispatched to a sick call of a male patient standing outside. The patient advises that he's feeling sluggish and is requesting to be checked out. You arrive on scene outside at a park with the patient standing outside, standing by a tree. What two things do you need to consider as you approach the entrance? The answers are BSI, or body substance isolation, and scene safety. So you put on your gloves before you exit the ambulance while inspecting the outside, noting that you don't see anything suspicious as you move forward. You walk up to the patient and locate a male patient who's approximately 30 years old. He appears to be standing outside against a tree. He appears diaphoretic. There's signs of urticaria and angioedema that are noted on the patient's lips and eyes. The patient is ANO times 4, and he advises that he was jogging outside when he started to present with these symptoms, approximately 15 minutes ago. The patient advises that he has pain to his face that is currently an 8 out of 10 on the pain scale. Patient's pupils are 3 millimeters. What is the next step to treating this patient? The answer is gathering vital signs. However, medication should be considered as well. You gathered your vital signs, and your patient's blood pressure is 108 on 64. The heart rate is at 124. They're satting at 85%. Their respiratory rate is at 28. Their temperature is at 99.3 degrees Fahrenheit. And their blood sugar is at 216. What are some differential diagnoses that we can gather from just this initial assessment? Two potential diagnoses can either be anaphylaxis or an allergic reaction. So what are some medications we can consider administering while in regards to the patient's allergies? We can initially consider administering epinephrine 0.3 milligrams intramuscularly, or an EpiPen autoinjector, which is generally going to be the same dose for an adult patient. We would consider two interventions after this point. But we could also consider albuterol at 5 milligrams to 6 mLs, depending on your local protocols, that is set at a nebulizer between 6 to 8 liters per minute of oxygen. For Benadryl, it can either be 25 or 50 milligrams, either IV or IM, again, according to your local protocols. Methylprednisone or Solumedrol. In this case, we'll say it's 125 milligrams, either IV or IM. And you can also potentially consider administering 0.5 milligrams to 1 milligrams of epinephrine via an IV over 2 minutes for severe life-threatening anaphylaxis. Of course, always look at your protocols and your SOGs. So, besides medications, what are two interventions we may also want to consider after administration of the epinephrine? Two interventions that you can consider are performing a 12-lead EKG or ECG, which you may need to consider doing before you administer other medications besides epinephrine, and also establishing an IV. So you perform a 12-lead on your patient, and this is the rhythm that they present with. What do you see that's abnormal? So to determine whether this EKG is a sinus rhythm or sinus tachycardia or SVT, we can use what's called the box method. So as you can see here, we have these blue lines that kind of help indicate that we're looking from one QRS point, which is the thin spike needle that you see, where the arrow's pointing, and we can measure it up to the next thin spike. We can measure the pink squares, which is more so the darker pink outlines that form these boxes. Look at the darker lines versus the thinner lines. And we know that if a QRS, which is the thin spike, if it's one box away from each other, that's going to be at a heart rate of 300 beats per minute, where the heart is beating incredibly fast, and that's the ventricles each time. But since we have a little bit more than two boxes, we can see that once it reaches two boxes, it's 150 beats per minute because you just take 300 and divide it by 2. If it's 3 boxes, then it would be 100 beats per minute because you would take the reference number 300 and divide it by 3. What we'll do is we will choose a beat or a QRS that's just in line with the pink line. So as you can see, I drew an arrow to one that's matching up with the pink line. And I've looked from that QRS to the next QRS, and I can see that it's roughly a little bit more than 2 boxes. I would say 2 1/3 of a box. So I know that it's less than 150 beats per minute, but it's greater than 100 beats per minute. So I know that we're not dealing with SVT or a sinus rhythm, we're dealing with sinus tachycardia. Please note, however, that there are other ways to determine what the rhythm is. That is just one simple way of determining, okay, the heart is beating at this many beats per minute. And even then, there are different rules, but it'll apply to this rhythm. So, you administer your medication and you reassess your patient. But if these were our current vital signs, what changes do you expect after administering epinephrine 0.3 milligrams IM or intramuscularly and albuterol 5 milligrams via a nebulizer? More so, what vital signs are going to go up, what's going to go down, and what should stay generally around the same? The new vital signs are as follows. Their new blood pressure is 124/72. Their heart rate is at 136 beats per minute. Their SpO2 is at 95%. Their respiratory rate is at 20. Their temperature is at 99.3 degrees Fahrenheit. And their blood sugar is at 216. Your patient advises that with the administration of epinephrine and albuterol, they feel that it has become easier to breathe. But they feel like their heart is racing and their teeth is chattering. You expect this though, since you have administered the 2 medications, and you note that this is a potential side effect, but it's acceptable in regards to the patient potentially not being able to breathe with the additional swelling of the airway. You look at your patient and recognize multiple stingers are on their face and neck. The patient advises he was jogging whenever he thinks he was stung by multiple bees, but he could have sworn that he outran them. The patient is asking you to remove the stingers. How should you go about this? Should you A. Remove them with your tweezers, B. Remove them with your fingernails. C. Remove them with a credit card. Or D. Tell him to pull them out himself. The correct answer is C. Scrape the stingers out by using the edge of a credit card. If you squeeze the stingers as you are removing them, you can risk causing further envenomation to the patient. Now, what is our final diagnosis for this patient? From the information gathered, we should suspect that this patient is having an anaphylactic reaction caused by allergies from reacting to a bee sting. If the patient has had similar symptoms but did not have any stingers, you can potentially consider that this patient is reacting to ACE inhibitor medications as a potential cause, especially with the angioedema. Note that depending on your agency, if a full airway closure occurs, you can consider potentially using a surgical crike, which may be considered in a worst case scenario. Also note that the epinephrine generally takes 2 to 3 minutes, but it is very effective for this type of scenario, and depending on your local agency, you may be able to administer this medication every 3 to 5 minutes, depending on your protocols and your SOGs. Thank you all for watching. If you like this video and you want to see more, please leave a like and comment. It shows that people want to see this, and I'll keep creating more. Thank you guys. I'll see you on the next one.